made me fight for my life. I'm so happy she was there for me. This is so painful. I just wish people would comply and we all get better.
I think it's frightening. It's really frightening because you get, all these people who are young and you can relate to them, and they've got young kids at home, and and it's also really variable who gets the severe form of the disease, because one of the youngish gentlemen we've got on the ward just now, who's a 53-year-old chap, all his family got it, but he's the only one who needed to come in, and the only one who got the severe form of the disease.
I thought I was going to die. It was so painful. I didn't eat days and days. And all I was thinking was the footage I've seen on TV about people not complying. And I was so upset about it. I wanted to go home to my family. I'm not dying here. Oh my God, man. It's like two little things on your shoulders. One saying, like, this is so painful, just give up. And go to sleep. And don't wake up. And the other thinking, I've got a family. And they've all got this. All of them. I have a little baby. And grandson, he's got it. And it just makes you have a different perspective in life.
The cases have definitely risen, and we've seen that in the amount of inpatients we've got at the moment. The variety of people that are coming in is very kind of variable as well. We've got people, from young ages, such as we had a lady yesterday who was 38, and we've currently got one on the ward who's 93. So it's really variable, and the course of disease is also quite variable in these group of patients.
I've never been in a hospital before. I didn't know these nurses were so good. And I got emotional. And not only was I ill, I was crying. I love my wife. I just wanted to get in here and get out.
Thank you, all of you. So much.
You're welcome.
Thank you. Very welcome. Thank you.
Enjoy yourselves at home. Stay safe.
You
enjoy yourself.
We will.
Stay safe there.
And thank you ever so much.
Oh.
I just wanted to say a few words to start our reflections this morning, and to say that this has been a year like no other, not just for us in the hospital but across health and care and for all of our local communities. But today, a day of reflection, we take a moment to remember all of those that we have lost this year.
There's no normal in any of this. For some, it's been really challenging on an emotional and mental health level. Hundreds of thousands are bereaved in this country alone. Worldwide that runs into millions. For others, this past year has been a year of their life lost, life put on hold until normal returns. This is a phone conversation I had with a relative yesterday whose dad died of COVID here in December. I rang because I heard that Derriford was marking a day of remembrance. I would like to thank everybody for how they treated Dad, but I want them to remember he was not a statistic, he was not a number. Life mattered, and his passing has left a huge gap in our lives. Before you all arrived, there was a robin sat on top of the speaker. A sign of spring, a sign of hope, a sign that things can return.
Much more open to going and helping in the departments and being much more flexible, friendly, and kind of open our minds to the way other teams work.
And I think we become really appreciative of everything that everyone does to keep patient care high and look after patients to a really good standard.
We've been more compassionate and caring towards our mental health. Lockdown has affected us in lots of different ways. So it's quite nice to see that we're all being more caring towards one another.
I noticed the willingness of people who wanted to make a difference and to see how the virus acts and how it mutates and things like that.
The office got moved around, so we were quite segregated in the office. Now we've become mixed, so we know other people from other teams, which I think is great. And all the staff that come down, they're so friendly. They're really high-spirited, even though we're going to stick needles in them.
So the support from the public has been very positive over the last year, both when I'm here in the hospital and when I'm outside. If people know that you work for the NHS, they will continuously thank you. And from the Trust, the free parking that is levelled at the staff has been much appreciated.
And everything's just been really good. Yeah, everyone's great communication within the staff, from reception areas, from the consultants, all the way through the department. It's been brilliant.
So for me, one of the positives has been virtual working. So it's not without its challenges, and some of them are significant actually, but I think it is here to stay in some way, shape or form, and I think it's got some positives for patients and for staff.
Anything really that can mean that the patient comes into hospital and moves through quicker, safer, and ends up being in the best place.